Hi, so back to talk about newborn fussiness, when fussiness is not normal. So I will not get to every single cause of newborn fussiness because it's probably an endless chapter, but I will get to the most common causes. So like the last post, normal newborn fussiness starts around 2 weeks. So abnormal fussiness. Many causes. The first, let's talk about vomiting. So when is vomiting or spitting up, excessive spitting up, not normal? So we think of spitting up as just like milk that's coming up from babies that is, can be any time after they eat, not necessarily right after they eat. Some parents will say, oh, it happened like right before they were about to eat again. That can be normal, so I don't worry too much about it, especially breastfed babies who you don't know how much they're getting and they might overeat. If you're bottle feeding, sometimes you shake the bottle too much, tons of bubbles, they're swallowing too much air, and bleh, right? They have too much bubbles and they spit up. I had 3 of my 4 kids were terrible spitters. It doesn't necessarily mean reflux if they spit up, okay? It just means like babies don't have a very good sphincter or muscle that tightens between their esophagus and their stomach. So things can freely flow between tummy and esophagus and sometimes right back out of their mouth. Now, if they are projectile, meaning across the room, and really nothing is getting absorbed, meaning they're dropping off in their urine output. So you're not noticing wet diapers anymore. You're noticing increased hunger as if they really aren't absorbing what they're eating. And that this spit up is new. It's not something that they've really done before. This is vomit and they haven't really done it before. Then we think about something called pyloric stenosis. So that is the muscle between the stomach and the intestines that is too tight. And so the milk is hitting this like really tight muscle here and just coming right back up. So nothing is really getting absorbed. And we look at an ultrasound at that little muscle and we determine if that muscle is too tight or that sphincter. And then they need a little surgery to, loosen that muscle up. Okay, so if this all of a sudden your baby is spitting up, 4, 6 weeks old, and they've never done it before, and it's like across the room, and the baby looks hungry, and they're not urinating often, please come see us. Other abnormal sort of vomiting, spitting with fussiness. So if the spit up is not milk colored and it's bright green, that is not normal. So, that could mean that there is a flipped stomach or a malrotation in the abdomen. Please bring your baby in. When do we call something reflux instead of just spit up? So happy spitters, we don't worry about, okay? So if your baby, the majority of the day is okay and just spitting up, then it's nothing to be concerned about, and they're just having that 1 to 3 hours of fussiness a day. If your baby is spitting up all day long and is crying all day long, so in excess of 3 hours a day, okay, and in excess of more than 3 days a week, then we start to think about colic or something we call milk protein intolerance. This is something that doesn't start right away. This is not something that starts in the hospital when you are first breastfeeding or you're first bottle feeding. It has to take a few weeks or a couple of weeks to start to develop. Colic, we really start to see the baby develop around 4 weeks old. The milk protein intolerance, maybe a little bit earlier, maybe it's 2 weeks, it can be 4 weeks. But the baby is excessively spitting up and very, very fussy. 3, 4, 5 hours, maybe all day. Maybe you can't calm the baby at all. And the stools are abnormal too. So babies do have very wet stools. And I'll have parents tell me their baby has diarrhea. Baby stools are not solid, okay? That's normal. But the stools for milk protein intolerance tend to be mucousy, and sometimes you can see a little bit of blood in it. Sometimes we have to test the stool to find that blood. But the key to it is that the baby is excessively fussy. Now, sometimes that doesn't mean that they have milk protein intolerance. Sometimes it just means colic. I had a colic kid. It was my second kid. It was really, really difficult. Nothing made him happy. And this was, 13 years ago. So, maybe he did have milk protein intolerance. I don't know, because that was sort of a new concept back then. With milk protein intolerance, babies are allergic, temporarily allergic. So this isn't like they're going to a long time be allergic to milk products. This is a milk protein allergy, where their intestines are irritated by the protein of cow's milk and often soy product too. And so a breastfeeding mom will have to eliminate milk products or dairy products and soy products. A formula-fed baby will have to be switched to a broken down or elemental formula such as Nutramigen or Alimentum, sometimes something called Elecare, depending on how serious it is. And after 2 weeks of elimination of those products, the dairy and the soy proteins, the babies tend to do perfectly well. In more serious cases, before it's caught, babies might lose weight, but we often catch it before then. But these babies are very fussy. They're very fussy. A colic baby, and I think colic is thrown around too easy to just describe fussiness, but there is a definition of colic, which is excess fussiness of over 3 hours a day, over 3 days a week, for more than 3 weeks in a row. We don't really know the cause of colic. There has been lots of talk and studies on what is colic, everything from intestinal spasms to early migraine, processes in the neurological system, and what is the solution for colic. Often, there is trials of things like using these milk protein, these broken down formulas or dairy-free, soy-free diets. And it's not necessarily that it's going to fix colics. Colic often is something that babies have to outgrow. And many babies will outgrow it around 4 months old. I worry a lot for our mamas and daddies who are dealing with colic babies because it's exhausting. There isn't a fix for it, whereas our milk protein babies tend to calm down after they're switched to their proper diet. A colic baby won't necessarily calm down and be less fussy. These babies continue to be fussy, and that can be incredibly exhausting. And the more exhausted a parent gets, it can bring on some postpartum issues for parents, for particularly our moms. And so I really want to make sure our moms are aware of what it is, seek help if they need it, know that they can leave their baby in the bed and take a break if they need to. I've lived this life before. It was a long several months for me. And I had a lot of tears over this. I remember just 4 a.m. tears pouring down my face, and my husband wanted to know why I didn't wake him up because, he was working, and I felt guilty that I couldn't fix this, and I should be able to fix it. It's a lot on a mom and a dad, but seek help from your pediatrician. Moving on from colic, other things. So you need to make sure your baby is gaining weight. So if a baby's not gaining weight, there could be fussiness over not having enough calories or failure to thrive. Other causes of fussiness is, constipation, although that's not super common. It is common in our preemie babies. We are okay if babies do not stool for around 5 days. So, I wouldn't worry, particularly in our formula fed babies, for them to be not stooling within like a day or two. It's not an emergency. So by day 5, you can call your pediatrician, say, is there something I need to do? A lot of times rectal stimulation will help. Other causes of fussiness in babies, if someone else is watching your child and you're concerned about something like shaken baby, that can be a not common cause, but something we look at. Other things, so corneal scratches. So, babies have sharp little nails and they can get their little eye scratched. That happens and they heal quickly, but if they're super fussy, I will look for that. The other thing that happens is they can have a little like hair that is wrapped around a little toe or something like that, and we will look on their fingers and toes to make sure there's no like tiny hair that's wrapped around a little tiny toe. But the major things we're looking for are things like pyloric stenosis, milk protein allergy, and colic. And I would say reflux. We trying not to treat that medicine wise anymore. We're treating it more with like keeping them elevated after they eat. We notice reflux with a lot of re-swallowing, arching, and waking up. If they're not waking up frequently in the middle of the night, I know they're waking up regularly anyway, like 2 to 3 hours, but if they're sleeping 2 to 3 hours without waking up, they're probably not refluxing. So reflux is painful, whereas spitting up is not painful. So there's the difference between that, but we don't often use medicines anymore. Sometimes we'll use thickened feedings if we feel like there's a problem with weight gain or something like that and it's interfering, but we try not to use medicines anymore for reflux, just for long-term issues. So overall, those are the issues or things we see with abnormal fussiness. So, but most of the time, we are dealing with normal newborn fussiness. So, if you're concerned, always reach out, and we're happy to just, ease your mind or say, hey, come in, let's take a look. I mean, that's always something we're willing to do because you never know. We never know until we take a look and see. Okay?